good afternoon, everybody, and thank you very much, Jim, and thank you very much, CEmPaC, for inviting me here to present today in this conference. I'm coming from a research group, which is part of the Polytechnic University of Madrid in Spain. The group is called Life Supporting Technologies, and as its name says, we are trying to develop solutions that are based on technologies most of the times to try to improve quality of life of people. So from that perspective, and in this session, what we'll try to do is to share with you some of the challenges and opportunities that we are facing during the years when we are trying to use this technology for empowerment. No matter what concept of empowerment you are using, the truth is that we've seen during the years that there is a big relation between this concept, empowerment, and technology. We've been seeing that for decades, we're having new solutions based on technologies for addressing some important issues like promoting health literacy, promoting self-care management, or helping people to make better decisions about their health. The thing is that according to the session, and I was wondering about this question that we have in the session today, is that are these technologies, are these solutions really leading to widen the health inequalities? This is a very complex question, as you can imagine, and I was trying to answer it from the pure technology point of view, from the pure point of view of somebody who is designing and implementing and developing and validating solutions based on technology. And if I'm trying to answer the question, my answer would be maybe. Maybe because it depends on three main aspects. The first one would be how you use technology. Second one would be the type of population you are actually addressing. And the third one would be how you design and actually develop the solution based on technology itself. And I have gathered here some of the most important challenges that I think we are facing when we are trying to develop these technological solutions for empowerment. It's just an example. They are not all here, but these are, for me, based on my experience, really key. The first one, I just mentioned it a little bit, is how we use technology. Technology should always be an enabler. What do I mean with this? From the engineering point of view, it's very common, and it has been very common in the years, that a new technology appears and somebody starts building solutions based on that technology that are not really facing the real problem that we are dealing in health. So technology for us should be always a tool, an instrument that can help us to solve another problem that people usually have. Then we are dealing ourselves with an ecosystem that is very complex. Health domain is really complex. It's about the patients and the citizens, of course, but it's also about the healthcare professionals and another group of stakeholders that are around there that might be quite important when we are developing the solution, being digital or not. So these stakeholders can comprise policymakers, hospital managers, pharmaceutical companies, manufacturers of different digital devices, medical devices, to mention just a few. And we have to focus on this ecosystem when we are building the digital solution, because otherwise the solution is not going to be complete and it's not going to work properly. The third aspect that I consider very important are the processes. When we are trying to incorporate a new empowerment solution based on technologies, what we are actually doing is doing things in a different way. So we actually have to revisit sometimes the processes that we are having in the health domain and sometimes the organization itself. So having this in mind is always really, really useful. Then we have regulation. In the last years, we have seen the appearance of certain regulations that are affecting the health domain, like GDPR, MDR, we will have artificial intelligence regulation really soon. And all these, of course, ethics, all these are really affecting the way we design and we develop our digital solutions for empowerment. And then last but not least, I have mentioned three aspects that for me are really key, and maybe they are not the most important ones, but I think it's mentioned to highlight them. These three are usability of the solution, cost of the solution, and trust. Somebody else mentioned before this aspect of trust during this afternoon, and I think it's really relevant because if we don't trust the technology that we are using, we don't trust the digital solution that we are using, it's not going to work. It's never going to be adopted, and it's not going to serve its purpose. The same goes for usability, of course, and I'm not going to talk about this because you are all experts in the field, I'm really sure, based on the presentations that I've seen. And also the cost. The cost is really important, and when we are dealing particularly with technology, we have to take into account that people may not afford the last piece of technology device that we are promoting or the last piece of tool that we are promoting, and we have to take a balance in order to promote this. So a lot of challenges that we are facing for developing this solution. Sorry, oh, okay. But we also, the good news is that technology also offers a lot of new opportunities to do these things in a different way and to actually empower people. And I'm going to give you a couple of examples based on our experience for the recent years. The first one is Activate. Activate is an Horizon 2020 project that was the first and only large-scale pilot focused on active and healthy aging. This project tried to develop solutions based on a technology, Internet of Things, to promote independent living, to mitigate frailty, to preserve quality of life and autonomy of elderly people. And we did this by building different solutions that were immersed in what we call smart living environments. So a whole bunch of solutions were developed under this project, and they were tested under 9 development sites with around 8,000 senior people and caregivers. One of the sites was based in Madrid, where around 1,000 participants had the chance to test and experiment themselves for almost a year, and even more than that, and we'll comment on that right now. Different solutions that were addressing the lack of healthy habits, cognitive decline, sedentarism, frailty increase, or social isolation. During the project, we did a pilot, a quasi-experimental study, and we did certain measure points. The results were really good, and you can check them in the website of the project. That there's a lot of information there, but I wanted to highlight here today the results of a questionnaire that we did a few months after the project actually ended. So we asked people about certain things, and they told us this. 80% of them considered the solution that was called Maja in Madrid really useful, and 44% of them were still using the technology after the project had ended, which, I mean, it might not be that much or look that much to you, but considering the adoption of digital tools, we think it was a really good rate that we finished intervention. People were still using it. 56% of them considered that the quality of life had improved after using our solutions, and then 46% considered that the physical condition had improved. A second example is this project, Gravitate Health, which is a public-private partnership with the pharma industry that we are addressing right now. So now here we are facing the following problem. Imagine a person like the one you see in your left side of the screen. She's called Maria, by the way, that has multimorbidity condition, and she has to take certain list of medication that is quite long. Not as long as our speaker at the very beginning of the session today mentioned, about 40, 50 medicines, but yeah, still more than 10 of them. And then for each of these medications, she would go to the pharmacy, she will get a package, and she will receive inside the package one leaflet that looks like the right side picture on the screen. And then she will have to manage all this information. So she will have like 10, 15 medications, 10, 15 leaflets with a lot of information in there with possible interaction between them, which is like quite complex. So we wonder ourselves, is there a way to use technology and find a solution that can transform the way patients access and understand this information and apply this to their personal health for increasing their adherence to treatment, to minimize the risk, and also increase and improve their quality of life? So obviously we thought that it would be possible, and we are working on it. So we are building a solution based on different technologies that is trying to personalize the information that each person is receiving regarding the medication based on information we gather from the electronic healthcare records, the electronic product information, which is the electronic version of these leaflets that you see in the picture, plus some health education material that can help this person to really manage and understand all this information that she's getting. So this is what we are doing in this project. We haven't finished it yet. We are actually quite in the beginning of it, and our aim is to actually empower European citizens around this concept of health management in terms of medication. So these are just two examples. But of course, none of them, and I could give you more, can be done without the use of technology. And the tendency is that this will continue to increase, because we are now seeing that in the health domain, and particularly in empowerment, new technologies are appearing and new technologies are being used, like, for example, artificial intelligence, robotics, blockchain. We are even seeing some things that are applied to new concepts. We are now talking about hospitals of the future that entails, among others, for example, hospitals at home. And all these concepts and all these new solutions for sure require empowerment, for sure require the use of technology, and well, for sure they will come with new challenges that probably are not in the list that I mentioned to you before. But going back to the question that we had in the session, can this lead to health inequalities? Again, probably yes, but I'm just trying to be optimistic here, because I've seen a lot of kind of pessimistic comments. My position here would be like, okay, if you do things what I call right, or if you try to do things the best possible way, if you just try to address all these challenges, and if you actually try to include all the people in the picture, probably you will lead to solutions that actually empower people that are usable. And we are seeing these things like hospitals at home that are now being implemented. They are currently implemented in Spain in some hospitals for sure. So my question to you, and I wonder in myself, but I'm going to give you the question to you also for debate, is that can really empowerment help to actually change the paradigm? Can empowerment really help to transform these healthcare systems? I'll leave you with this question. Thank you very much.